We have a new and improved OIG. I think under the leadership of Doug Wilson and Jack Stick, there have been some profound changes made in the Office of Inspector General with a keen new emphasis focus on fraud prevention. Their investigation time has been reduced from 42 months to 2 months. That allows more time for investigations to be conducted. And there's also a triage system in place. For instance, they may have 10,000 cases pending, and in the past those cases were taken in order that they came in. So now there's a priority assigned. So if case number 10,001 may involve $200, but another case above it may involve $20 million, then they reassign that and look at where's the biggest bang here, where's the biggest return on investment. So you have an improved business mentality being applied to what happens in our Office of Inspector General, and that's combined with technology. There's a major emphasis now on identification of using technology to identify high-value potential targets. When you look at it, we have the technology that we can use to predict where an improvised explosive device will be in a street in Afghanistan. You can use that same technology to apply it and predict where fraud will occur. So I think you're going to see much more sophistication coming out of the Office of Inspector General in the coming months and years.
Good. I have to tell you, every person in this room ought to be furious over all of these. It doesn't seem like a night goes by that I don't see some news story on a new method of bilking the system. And every penny that we lose to waste and abuse is a penny we're taking away from people who need it. It just makes, and I think we're doing a better job, but we still need to do more.
You're right. We need to do more on the front end to prevent it and identify it, and not go to the pay and chase system we have now. And I think Jack Stick and Doug Wilson are committed to that, and we're working very closely with them.
Good. Senator Rodriguez?
Do we have any way of comparing how we're doing with our enforcement effort compared to other states?
We do. The OIG is very active, and there's an association of like state OIGs, and so they compare what they're doing. The difficulty is, there's a saying that if you've seen one Medicaid program, you've seen one Medicaid program. They vary so much from state to state. But they probably share some of the same high-profile services for fraud that they can talk about. Generally, those services are dental, has becoming an emerging issue around the United States, and services that are delivered in the home.
But in terms of monetary collections, do we have a comparison? Is that part of what we can review?
I believe
what we're doing?
Let me check with OIG. But since our program is so much bigger, it may be a percentage or something that we can assign and look at that and compare state to state and look. I know that we're looking at best practices around the United States.
Thank you. It occurs to me, just like Senator Nelson said, that you read from time to time about these fraud cases, and then you see the reports about how much is being lost to fraud in the Medicaid program. Is it a lack of resources for investigators or other enforcement initiatives or some kind of tracking system that can get to these cases a lot sooner than what that I hear about? Because usually, we have a dentist in El Paso that just was in the paper last week, and 3 years that person has been committing fraud in the program before they were finally brought to justice and their license lost. So why does it take so long? Is it an issue of a need for more investigative resources or some electronic tracking kind of systems, such as what we've been talking about, that could, as soon as people start submitting false claims, that we can quickly detect that?
I think our OIG would tell you both, that in the past there have been so many allegations that you couldn't possibly work through all those. And so now that we can, one, triage those and identify the higher profile, high cost ones, you can get to those earlier. And that's what has cut down on the investigative time. We're going from 42 months, 45 months to 2 or 3 months. And also, we have a commitment now to use more technology that will really start weaving the web of who all is involved in this, what providers share that same kind of patient, what kind of profile do we have about that particular abuse. So I think you're going to see profound changes, and I suspect that if you asked Inspector General Wilson, he would encourage that you consider additional staffing for OIG.
Mm-hmm.
It would pay for itself.
It would.
Yeah.
But I think the technology has to be there, because the technology ultimately, this is not a shoe leather kind of investigation. This is really qualifying the information, getting what you need by identifying aberrant patterns of use.
But I feel like we're playing whack-a-mole. Remember that old kid game? We uncover one type of abuse, or I will say fraud, and look into it and go after it. And in the meantime, there's another entity out here figuring out a new way to build the system, and it seems like we just can't stay ahead of the game. So, whack-a-mole. You never played whack-a-mole? Right.
Did you play whack-a-mole?
Well, is there anything we can do, Billy, to get ahead of the game on this? I mean, are there some, I don't know, red flags that... It just amazes me. Every night it seems on television I turn on and here's another type of abuse fraud that is being uncovered by some investigative reporter, and I'd like to be in front of the investigative reporters and try to get to the problems before they get so big.
Well, I think it's the combination of use of technology, OIG, and then the relationship between what I do in Medicaid and the relationship with OIG. We are working to more solidify that. For instance, I've created a cost containment unit within my area that looks at cost trends. So we never, ever again assume that a cost increase is associated with the wrong thing. Mm-hmm. For instance, associating the increased utilization of dental services with FRU. We needed to dive deeper into that. So we have more conversations with OIG before we implement a policy, so they know what changes we're making, so that they can look for some of the
yes.
aberrant kind of things that you'll look for.
Yeah. And I think the FRU, when we talk about the orthodontic issue, I think that the FRU case was used as a, an opening for some of the abuse that took place, and as an excuse, but it's still wrong.
You're right.